Good morning. Today is September 29th, and I am 1 week post-op from anterior fusion for L4, L5. 1 week exactly today. My surgery was on September 22nd. It's actually my second surgery. My first surgery was in December of 2015. It was a lower lumbar decompression. And now I just had the fusion. It was an injury from my job, Ford Motor Company. But anyway, I just want to get on here and just give a little bit of my experience since my surgery last week. I should have posted a video before and after, but I figure 1 week will suffice. Well, I could say right after my surgery, they did something called a block, which they numbed the nerves in my stomach to where after the surgery, pretty much 24 hours, even up to after 24 hours after the surgery, I had no pain. Everything was numb. I had no pain. I was in good condition. The next day is when all the numbing started to wear off, and everything started to come to life. And I had to take a little bit of the morphine drip just once, and that sufficed as far as my pain level. And the doctor said that I was pretty ahead of schedule as far as my pain levels, what I'm feeling, and my maneuvering and everything. So let's see, I had my surgery Wednesday. Friday, Friday I was able to come home. And my experience being home since my surgery, I have my husband here that helps me around with everything that I need to do. But it was pretty hard when I got here because I have steps in my house. It was pretty hard, going up and down the stairs. So I had to delegate which area of the house I was going to be in until I was able to maneuver a little bit better to go up and down the stairs. So my first day here, I was in the bed most of the time. And my pain levels were still controlled. The doctor gave me hydrocodone, I think 325 milligram, and I would only take half of it, and that would help with my pain. So I have a bottle of 30. I think I may have used 25. May have used only 5 since I've been home. And that's because I've only taken, a half whenever I need it. So yeah, every day it's been a little bit of progression, I can honestly say. I'm still, needing assistance with a walker that they gave me from the hospital. Just getting in and out of bed, trying to, do things more independently of my husband. So I'm using a walker to get in and out of bed. But as far as going to the bathroom on my own, I can do that. My husband has to help me in and out of the shower because it's too high for me to, lift my legs to get in and out. But my pain level, I think I pretty much have it under control. Whenever I feel, pretty much I can tell when the medication is wearing off. And when I know it's wearing off, I'll give it some time. And then if I feel that it's going to get unbearable, that's when I'll just take another half. Kicks in pretty fast, so I don't really have to bear much pain at all. Um, they say, the doctor told me no bending, lifting, or twisting, which, I've been abiding by those rules. Definitely because I really can't do much of those anyway. So I'm not going to push myself beyond what I know I can't do anyway. Um, as of today, I'm able to slowly, using handrails, I'm able to slowly go up and down the stairs independently, and still walking kind of slow, but not as slow as I was when I first came home. I'm walking around my house. I haven't been outside since I've been home from the hospital. So most of my walking, as far as exercise go, is in the house. Um, I do notice that the longer you sit, the more stiff you get, and getting up after that long period of sitting is kind of painful. So I advise you to move around as much as possible. If you don't use it, you lose it pretty much. But I do advise as much walking as you can bear, because you got to get those muscles back functioning the way they were prior to surgery. Um, Let me see. I have noticed that with trying to stand and sit, the pressure that I put on other body parts makes them a little sore. Um, Getting up from the couch puts a little extra pressure more on my left leg. I'm feeling like a sharp pain, like a nerve pain almost, going down my left leg at times. And then when I walk, it's almost like it wants to give out, but eventually it goes away. But it pretty much happens maybe 85% of the time I'm trying to stand up from a place I'm sitting. So I don't know if it's how I'm maneuvering while I'm trying to get up, or if it's something that's just occurring anyway, but it will eventually go away. But I have a doctor's appointment in another week, and I'll ask my doctor about it. Um, Also, um, I have a tightness. I don't know if I'm just stitched up extremely tight, but it's on the left side of my stomach, which kind of gets a little irritating. For the most part, other areas of my stomach is okay. Down in the incision area is still swollen and it's still numb, so it feels a little weird. But the left side of my stomach is where the irritation comes, every now and again. Um, Bowel movements. I've had one bowel movement since I've been since the surgery. And that was actually Saturday morning, the next morning after coming home from the hospital. And I've been back to a regular diet. So constipation is a little issue right now. Um, I am able to, pass gas, but just not have a regular bowel movement, which could possibly be the issue for that slight pain on the left side of my stomach. Maybe with the regular foods that I'm consuming now, I need to, get that out. So that could be that pressure that I'm feeling. But nonetheless, I'm going to, the doctor told me to take some Miralax, and I'm going to get some of that, take a little bit of that, and just see how that works for me. But overall, I think my progression is pretty good. I'm not I'm still not doing any cooking or cleaning or anything. You know, my husband is handling all of that. But for the most part, I'm independent as far as getting in and out of bed, up and down from sitting positions, um, going up and down the stairs, going back and forth to the bathroom. Those are my independent areas. But I'm still, you know, just needing help in other little areas, but not as much. But I think in another week, my 2 week point, I'll come back with another video to let you guys know how I've progressed since today. And maybe I'll have a photo of my incision for today, comparing it to for next week Wednesday. But that's pretty much it. If you guys have any questions, please leave them in the comments below, and I'll try to answer them as best as I could. Until then, I'll talk to you guys next Wednesday.